that day.
And so it sounds like in the past, to buy drugs, you go to a street corner, a dark alley, or wherever, and now you can just walk to your medicine cabinet.
Mm-hmm.
Right. What are your thoughts on pain itself? Meaning, you know, drugs are a way. There's all sorts of different avenues. There's of course acupuncture, there's chiropractic. What are some other ways people can safely treat pain without having to use drugs when there maybe not be as necessary?
There's quite a few, and a lot of it is culturally related. Our perception of pain is based in part on our culture, and based in part on genetics, and based in part on our environment. So that, you know, I believe acupuncture, acupressure, meditation works, yoga works, visualization works. There's a lot, exercise, stretching, discussion. It's been also shown that if you're happy, your pain goes down. You can tolerate more pain. So simple things like that. And my feeling is that some of these patients, at least not, you know, all of them, but certainly a large percentage of them, would benefit from anti-depression therapy. Now I don't mean necessarily drugs, but maybe group therapy and things like that. So drugs are, in my mind, certainly not the only answer. And if it were me, I would definitely want to use every other modality before I started using these chronic pain medications.
No, well, but then why does it happen? For example, that old saying, hugs, not drugs, maybe there is some value to that, right? I remember reading that in my school in the 6th grade. Why is it that people will use drugs, go through surgery, as opposed to looking at some of these other things first? As an acupuncturist, David, one thing you mentioned was a lot of times people will use you almost as a last resort.
Right.
Why would they do that as opposed to using you as a initial resort?
Right, it's just because, you know, as acupuncture right now is just not in the mainstream yet. It's getting closer, but, you know, say Mayo Clinic, in the Mayo back pain clinic, acupuncture would be used as one of the first things to try, and then go to the more invasive therapies later on. So that would be, in an ideal world, that'd be nice, you know. When I was in China, I worked at a hospital there for a while, and that's how they integrated everything so nicely. So you could have those options. You could have acupuncture as an option, massage, physical therapy, and of course we have physical therapy and massage here too. And then, as needed, you go on to the more intensive or invasive therapy. They're all necessary, you know, and there's a time and a place for each one of them. So
if I broke my bone, I wouldn't come to you as an acupuncturist and go, hey, can you take care of that?
No.
All right. So, Dr. Tietz, I think you hit it on the head when you talk about culture. Why is our culture, what do you think, why is our culture so pilly? Why do we run the pills for our solution?
Wow, that's a complex question, but I can tell you there's a lot of reasons in my mind. One is we have the McDonald's phenomenon. We want an instant fix.
Mm-hmm.
So we have a chronic problem with our back, or we have our chronic obesity problem, for example. We want a pill to take, we want a surgery to cure it, and we want the easy way out. And so dealing with chronic pain is definitely not, you know, like instant drug, pain gone, because pain is a complex thing involving many sensory input and many areas of the brain. So therefore drugs are not, in my mind, not the answer. That's one reason why our culture is so hooked on. Another reason is the nature of our culture ourselves. We are a culture that thrives on young people, thin people, you know, actresses, nice teeth, nice hair, everything else. And so if you're not part of that, somehow you're put out of the mainstream and you want to be part of it. So that's another reason I think there is a problem in our culture. And another reason is we're wealthy. We are among the wealthiest cultures in the world, if not the wealthiest culture in the world. And therefore our access, our ability to buy these drugs, prescription or not, is increased over, say, poorer countries like Bolivia, where their drug of choice might be gasoline, where they sniff gasoline, which is a problem over there because they don't have the money. It's a human, I think if you look at it overall, humans, there are pleasure centers in the brain. And once those pleasure centers get activated, they crave more. But my point being, there are other ways to get that pleasure center activated. Exercise, meditation, all the things we've talked about, where you don't need necessarily as many or drugs at all.
If the drugs themselves, obviously there is an issue. There's a place for prescription drugs. There's a time to use it. You mentioned that they're prescribed in a certain way, taking a lot into consideration, looking at someone's history, what the problem is, and all of that. In an ideal world, David, what do you think the solution would be, or how should prescription drugs be prescribed and used, and what other solutions could people use?
That's a big one too. But I think, you know, with Dr. Tietz, the ER is, you know, acute pain. Then pharmaceuticals like Vicodin and painkillers, other painkillers would be the first choice, because I'm not going to be able to rid somebody of their pain by giving them acupuncture if they have a broken bone, you know, right then and there. So bring down the pain, bring down the inflammation, and then get them off of those drugs. But I think in the chronic pain department there has to be a lot of work done still in how things are dealt with, you know, and definitely try to lean away from overuse of prescription drugs. It's, you know, too many legal addicts are out there, you know, where they're just popping pills and that's the one option they have. And similar, like you guys were just talking about the culture, I mean, it's easy, you know, they don't want to really try that hard. Some patients just don't want to try that hard to do another alternative route, you know, whether it be go continue some kind of physical therapy, do yoga, stretching, meditation, acupuncture, you know, any of those kind of things that will help produce natural flow of endorphins, the pleasure chemical that your own body releases. So yeah, I think, you know, use it for acute and then move on.
I think there is a place for chronic pain medications. For example, cancer patients, patients with severe arthritis, patients with unrelenting migraines, and so forth. But that place is best served by physicians who are trained specifically in chronic pain, not in the emergency room where we're dealing with acute pain. So when we get patients who say, I lost my prescription, my doctor's out of town, whatever, it is to the point where we're saying, no, we really are not trained to do this and we shouldn't be doing this. So I think there is a place for chronic pain, but it is not in the emergency room, and it is not in those drug mills where these doctors are, you know, robo-signing these prescriptions in order to make a lot of money. And they're all over California, they're all over Florida, they're all over most states. But fortunately, we have a way to. In California, we have a prescription drug monitoring program where I get on the internet and find out instantly everywhere that patient has been and gotten prescription drugs, which helps us a lot. Instant, real time, and that helps deal with that. But getting back to your question about the chronic pain, yes, there is a place for it, but in my opinion, that place is not in the emergency room. That place is more people like you and chronic pain physicians.
When you mentioned 2 billion prescriptions, I know with the DEA, they're talking about last year for their drug take-back program, how much prescription drugs did the DEA collect?
There's over 100 tons.
100 tons
of meds.
Of meds.
Yeah.
Wow, that's shows that there's a lot out there. 100 tons. How many cars is that? That's
a lot.
A lot of cars. Next time you go to purchase a car, you look at the lot, and probably a bunch of those cars will equal prescription drugs. Dave Russell, any last minute points? Anything you want to include with this?
I just want to make it clear also, like what Dr. Tietz was saying, that when I said that it's good to start from the least invasive and go up, if those aren't working, and you know, for the chronic pain patients that do have to resort to the drugs, you know, there's no judgment involved, of course, you know. So just like I said, there's a time and place for each one of the modalities, and I just think it would be great in the U.S. to start integrating as much as we can to include, you know, these least invasive therapies that have as little side effects as possible, and then start, you know, going to the next step after that. That would be a great medical model.
Perfect. Prescription drugs, again, not a black or white issue. There's a time and place for anything. There's a time and place for surgery. There's a time and place for the drugs themselves. There's a time and place for acupuncture, chiropractic. Looking at other methods, yoga, meditation. I think we've been hearing about these for what? How old is yoga? Centuries? You know, thousands of years old. Maybe we should start listening to some of this stuff, right? I know I need to. Again, this is Wiki Verma here with Dr. Tietz at Petaluma Valley Hospital and David Russell with Russell Family Acupuncture. Thanks a bunch.